Hello, my name is Fern, and I'm president of the Italian Gaucher Association. My fondest memory goes way back to 1991, when Genzyme organized the first international Gaucher conference for parents and patients in Amsterdam. And it was really a very exciting and emotional experience, because I had never seen other Gaucher patients, and I was very, very touched by the whole situation. And finally, after a few days, I got the courage to stand up, because I was very shy at the time, to stand up in the middle of all these people and ask how could we start a Gaucher association in Italy. And at that point, I started receiving lots of notes and from Susan Lewis of the UK and Ria Gut from Holland, with suggestions and ideas and contacts and everything. And we immediately bonded together, and it was an unforgettable experience. And we were friends for the rest of our lives. We've been friends for the rest of our lives. And I truly believe that this conference was the kickoff for the future EGA-IGA. So it was fantastic. It was not easy in those days to obtain humanitarian aid for patients in need, because not all countries were able to offer this to their patients. The EGA, I mean, we worked quite a lot to get as much aid as possible. And one day I received an email requesting help for a Serbian child who was affected with Gaucher's disease. And he was very sick. And I immediately phoned our doctor in Florence, and I got in contact with the local regional health authorities, and I asked for permission to allow this child to come to Italy for evaluation and treatment. And we got the flights, we booked everything, and the child arrived. He was immediately put on treatment. There was a big problem, a big issue about this, because the representative for Serbia was not happy that the child was coming to Italy for treatment, because she insisted that the government must give them the treatment. But there was no association in Serbia. Nothing was happening. 5 years had gone by. It was all held up. So the child was already in treatment. We had a big meeting with many of Genzyme's important people, and of course Susan Lewis and Ria and other people from our group, from the, let's say, European Gaucher Alliance. And we met in Cologne to discuss this, and we explained that we wanted the guarantee that the child would receive humanitarian aid once he returned to his country. And we also managed to get humanitarian treatment for another 4 or 5 children. And this is what I define the beginning of the mass humanitarian aid carried out in Eastern Europe. And this proves also that patient organizations working together with the pharma industries can do a lot of good for patients worldwide.